Hi there, my name is Isabel Rose and I am so pleased to be speaking today with renowned healer, Dr. Linda Lancaster. Dr. Lancaster is what I would call the ultimate integrative healing guru. A little background about her. According to her book, Harmonic Healing, after studying various ancient healing modalities in places around the world like Sri Lanka and India, she returned to the United States and in 1987, she founded Light Harmonics, a healing and teaching center specializing in energy medicines. She uses a variety of disciplines like Ayurveda, homeopathy, and energy balancing. Her work is at once cutting edge and timeless. Welcome, Linda. How are you today?
Oh, thank you, Isabel. Nice to be here. It's nice to see your face.
So how has COVID impacted your practice? Have you seen any patients with COVID?
Well, yes. I think I was seeing patients back in New York in January, the end of January, early February, when I was there, because at that time I was seeing all the symptoms that came on as COVID. So we were a little ahead of the curve. And I still continue to treat the patients the same way when we found out, oh, it's this novel COVID-19, novel coronavirus. So we really didn't know how it was working, but what I didn't know immediately is it was robbing oxygen. The oxygen levels were going down. So if I used homeopathy in the right way, according to symptoms, I was able to mitigate it very early on. Most of the patients that I treated were better within a week to 10 days. And I thought that was a lot. I thought that was...
That is quick. How do you mitigate it with oxygen? Does somebody literally...
Oxygenating herbs. There are many herbs that are oxygenating that we can use, as well as homeopathy. There's many homeopathic remedies that can deal with the shortness of breath, can deal with that dry cough, can deal with the fevers. So if we use so for me, I'm a homeopath, so I use homeopathy as my main focus, alongside of herbs, alongside of diet, alongside of baths, therapeutic baths. So we use the old traditions to treat what comes in front of us. I think we're having so much trouble with COVID because there's so many preconditions. There are many people who are immune compromised. And I have always worked to build the immune system, to build the endocrine system.
Please. Oh my God.
So
sorry about that, Linda.
That's the problem.
It's real life. Sorry, there comes lunch.
Yeah, exactly.
So you're healing using the endocrine system and so forth.
Yeah, to do what we do to create natural immunity. I think that the fear that is around COVID is the worst of all, the fear around it. And yes, we know that the progression of the disease can go into scary places. We've all been shown it on the television. However, I've seen lots of COVID cases that I would consider them mild. I would consider them even just like a flu. Now, I'm not underestimating its effect, and we do know something more about it, which is it attacks the lung tissue, the mucous membranes. So, but if you can get it at the first sign.
But how do people know? Forgive me for interrupting, but isn't the problem that people aren't aware of the first sign? I understand that lots of people are walking around and they're asymptomatic. So what is the first sign for somebody?
The first sign could be anything. But it could be a stuffed up nose. It could be, I had a patient who had only symptoms of her nose was stuffed, but couldn't smell, and it had lost the taste of smell and taste and smell. And for that person, we treated it just according to homeopathic procedure. So, I think that everyone should learn some bit of homeopathy at home. Then we know now lots of the immune support that we can take. Vitamin C is oxygenating. Just that alone, higher doses of vitamin C. So once I heard about the COVID, that, okay, this is what it is. It's not just a flu. This is something that's really going around the globe. Okay, increase your vitamin C. Go to zinc. Go to vitamin D. If you can't get out in the sun, please take vitamin D. It's shown to be very effective.
And what if people do not have access to a homeopathic doctor?
Homeopathy at home is very, very easy. There are many courses, there are many books on first aid homeopathy. What I'm talking about here is that fever first comes on, give aconite. Then we may need belladonna. We may need gelsemium. We may need arsenicum. Learn the remedy.
So you're not using hydroxychloroquine and Zithromax combos, is that right?
No, I'm not. I am using quinine, but in the form of homeopathy, homeopathically prepared quinine. And it can be, and it's actually quite interesting because it does have a lot of the symptoms of COVID. So I understand why hydrochloroquine is working along with the Zithromax, but I'm not a medical doctor. I don't use drugs. Both of those items are drugs.
And so does that go the same for Lyme disease?
Yes.
And I know that, as I'm speaking to you from Project Lyme, so I am
my fellow Lyme's patients, because I have had Lyme's twice.
Okay. So most of us, many of us have lived in a world with compromised health. So for the Lyme watchers, are there, what can they do to protect themselves? How can they even know that they're not having a Lyme flare? What they're actually having is, COVID-19. Some of the symptoms overlap, don't they? A brain fog and Lyme is so individual, and it seems that so is COVID. So what would you caution the Lyme community? And does it need to take any special precautions? Are you treating any patients that have Lyme and COVID? Is there any difference?
Frankly, my patients who have Lyme's, there is no difference, because we still go according to the symptoms homeopathically. Okay. We still go according to most of us are on anti-inflammatories already, natural anti-inflammatories.
What is a natural inflammatory? Give me an example.
Curcumin, boswellia.
Curcumin. What is curcumin? I've heard of boswellia.
Turmeric.
Got it.
Yeah. So those are the recommendations of formulas for COVID. So I think actually the Lyme community is even more prepared for COVID. Unless they're compromised with drugs, if they're on medications, then I would see a problem. But I can't say that because my patients are not on medications or on drug medications, synthetic medications.
And how have your patients done? Are they healing in, are you finding their healing trajectory longer than 6 weeks? Would, 3 to 6 weeks? Is it
No,
symptoms
I don't.
lingering?
I have patients who have Lyme's, and they were better in 10 days. Better. I mean, they're better from COVID in 10 days. They were
Right.
tested before and after.
And are these patients also doing like a parasite cleanse, or doing in your book Harmonic Healing, which I had the pleasure of reading the last few days, you speak a lot about a frequent sort of body conglomeration that takes many people down. Parasites, toxic pollution, mold, help me out, what's the fourth?
Radiation.
Radiation, which of course we're sitting in front of our computers nonstop right now. And so you talk a lot about, there's like a 6-week cleansing, which you do, there's a parasite cleanse, there's also a breakfast, the liver detox, right? So one is the milk cleanse. Some people are familiar with that cleanse because Gwyneth Paltrow talked about it on Goop, and maybe popularizing it in a wonderful way. And the morning cleanse, I remember it had a lot of garlic in it, and I thought to myself, I'm allergic to garlic. Does that mean I can never try it?
The garlic is optional.
Oh, that's good, because I'm allergic to it, but that's okay for everybody else. Does your COVID practice, like your COVID,
I hope I don't have a COVID practice.
Does your COVID protocol, I meant the word protocol.
Patient practice.
Does your COVID protocol employ these cleanses? Do you recommend right away? Do you say I'd start this cleanse right away, or no?
No.
Okay.
I always say deal with the acute problem first. If somebody presents themselves with a fever or congestion in the lungs or sore throat or whatever the symptoms are, we deal with that because we know that we're in the middle of this. However, once that clears, for the most part, if parasites come up, then I'll do a cleanse. And when they first come to me, I've already started clearing them. So we're not on constantly taking medication for parasites. So, and yes, the milk cleanse is the way that I clear parasites, but that's a general terminology, parasites, because parasites, there are 5 different kinds of parasites or categories of parasites. Worms, a lot of people are walking around with worms. That makes we're never going to clear our parasites out of our system. We're never going to clear it. So forget about that.
Do they affect COVID? Like if your worm's living in you, did they impact it?
Of course, but let me finish about the parasites, because the parasites, that is our biome. We have viruses, we have bacteria, we have fungi, we have worms, and we have microscopic parasites, like in the case of Lyme's. For me, it's a microscopic parasite called spirochete, and it has an energy field, that's spirochete. And I go on to talk about the 5 elements of how they're all connected and how we treat them. So in the case of, I did not take any new patients during the COVID because I wanted to be available to my patients who I'm familiar with and I know what's going on. I just pull their chart. Sure, we sent emails to our patients that we felt needed a little bit more immune support. And we have not had that many COVID cases. I would say maybe a dozen documented that they were tested, and I know it was that. Although I've been treating this, and I'm now finding out my patients have antibodies. So it's been an interesting development. And I would say I don't do anything different than I would do for anything that comes across my desk. So we have the 5 parasites, which are culprits. And when they have an overgrowth or the numbers become too high, and it starts to imbalance the biome, that's when we would go in and do a milk cleanse. That's when we would go in and do a candida clearing and maybe use some good support like olive leaf or oregano oil, which is part of the recommendation that I did for COVID. I recommend either get olive leaf or get oregano oil. You don't need both, but trust these formulas because they work. Increase the vitamin C because we're more exposed. However, that liver cleansing drink in the morning is really high in vitamin C. So it's a matter of understanding that we're just this big biome and we've got viruses everywhere. We have bacteria everywhere. I mean, the fear around it is still, I would say, the worst. Arsenic amalgam will help you with the fear. Gelsemium will help you with the fear because the fear breaks down our immune system.
And along those lines, since so much of your work has to do with what you call the subtle art of balancing energy, supporting energy, how much would you say meditation might help literally as a tactic in the case of getting sick? It seemed to me that in and of itself might protect a lot of people to quiet themselves because there is so much fear and anxiety. Is that, I don't want to give you a recommendation, but that's a recommendation I took from reading your book.
Yes.
Do you suggest those types of practices to people?
Yes, I do. I really, in the book, I explain that it's really a lifestyle. Okay, we are living in a soup of pollution. I recommend therapeutic baths to mitigate that. But within our own soul, within our own energy field, how we strengthen ourselves is through meditation, through breathing, and through movement, but conscious movement. So when we talk about conscious movement, what exactly does that mean? Well, the physical, we have a physical body, but what moves us is our etheric energy, is our energy field. Interestingly enough, if you read about virus in my book, virus comes in at the etheric level. So we have to maintain our will for life, our will for higher good in order to overcome the virus. I say to my patients, and this is something I really want to say, the people who have COVID, who get it, it's a spiritual fight.
Can you just tell us a little bit what etheric means to you? That's not a word everyone might be familiar with.
Okay, I explain it very well in the book, but let me say it just briefly. So we have a physical body. We have bones and organs and eyes and hair. We both have hair. And yeah, so, and that's physical. That's all physical. There's no life energy without the etheric part of us. The life force is the ether. When we took our first breath, when we were born, that vital force, that ether came into us when we went, and we breathe. Now we're no longer a parasite on our mother. Now we have our own vital force, and we have an ether field. We have an energy field. And that energy field is where we get sick. Because we're getting exposed to a lot of air pollution. We're getting just the carbons alone in New York City, for instance, from the cars. We're getting radiation. I know that the 5G has come on in New York. That also is stirring up our cells and making our immune system a little more vulnerable. So, Yeah, so we have this energy field, and this energy field, we call it the physical etheric double. Okay, and it is intertwined. This ether is actually threads of light, actual threads of light coming into our physical being. That's what makes us alive. When we leave, the ether will go, our physical matter will stay.
So
This is the exciting part, really, because as we understand this ether is then connected to our emotional field, and then connected to our mental field of how we think. What is our purpose in life? And that purpose in life then reaches up to the divine energies.
The irony of this pandemic is that it has forced a lot of people to slow down.
Yes.
So my instinct tells me that people are confronting these questions probably to a far greater extent than they did previously, when they were rushing here and there, and they barely had chance for their bodies at the cellular level to relax. I know time is fleeting, and I want to ask you, would you have time for one last question?
Of course.
Why do you think our doctors in hospitals are missing so many of these modalities that are so available? Why are they failing to employ this more integrative approach?
I just don't think they've been trained in it. I know a lot of doctors are quite open and very integrative, and they're starting to do some of the modalities, especially vitamin C. That's cheap and easy,
Right.
The IV vitamin C's are very, very helpful. But
what about the oxygen? When I'm hearing about people having blood clots and
sure.
Having a leg amputated from a blood clot, or having stroke, and you're telling me that there are oxygenated herbs available, or homeopathic medications which are oxygenating, why aren't those lining the shelves of the hospitals?
It's pretty hard for a medical doctor to believe that these little white pellets, 1 or 2, will make that much of a change and turn a fever around and help to dissolve blood clots, along the side of some other things that we're knowing about. But know that most of those people had preconditions. I would love to see the preconditions of those people that have had that, because that's very typical of diabetes. You see. So, now's the time. Years ago was the time to live a holistic, natural life. Let's face it. This took me 40 years to write the book. It's about mitigating the pollution. It's about eating food that's imbibed with energy. I told you about the physical energy of us and the etheric energy of us. Organic food has that same energy field. If it is contaminated or grown in pesticides, it will have a low frequency, and we can't feed our electromagnetic energy. We can't feed our etheric energy. So food is number one for me. I use for my COVID patients, I use a soup called passata di verdura, which is green soup.
Fabulous. What kind of green soup?
I'm Italian, so and it's so fantastic. It's a bunch of kale. It's in the book. It's a bunch of kale. It's on my Instagram, Light Harmonics.
So I want to ask you to do me a favor. Would you please tell people who are following this today how they can learn more about you and follow some of your extraordinary healing practices?
Oh, well, thank you. Definitely. Please read the book.
And the book is called?
Yep.
There it is.
There it is.
Here it's harmonic healing, restore your vital force, your fingers over something for lifelong wellness.
Yes.
I know that it's on Amazon, and so
Yeah.
that if you can't get to a bookstore, which
Mhm.
I couldn't, and if you can't even get it delivered, it's on an audio book. I read it on my computer, and I literally devoured this.
So it's drinking water, hydration, movement, meditation. We have to connect.
Can they, do you have a website? Do you
Yes.
have, where else could people find you?
Lightharmonics.com is my website. Facebook, we have Light Harmonics Institute. Instagram.
Can people study with you when this is over?
Yeah.
They can
Oh,
come.
yeah.
Where are you based?
If it's not over, we'll do Zoom classes, I promise you.
You're based in where? In New Mexico?
I am in Santa Fe, New Mexico. I usually come every 6 weeks to New York, and my heart is breaking to not be there. So as soon as I can, I will come.
Well, Linda, I just want to, Dr. Lancaster, I thank you so much for spending time
Thank you.
with me and really with Project Lyme, and for anyone who's...
Can I say one more thing, Isabel?
Yes.
Yeah. I want to say one thing. You know, Lyme's is also another opportunity to get to know yourself, because that's how we really heal. We heal by knowing ourselves. Yes, we'll clear the spirochetes out. Yes, we'll give you good diet. Yes, movement, meditation, therapeutic baths, which are in the book. We need to do everything. I used to say, oh my God, I have to tell them another thing to do. Oh my God. It is lifestyle. And the only way to heal, as far as I'm concerned, is that you do it yourself by embracing natural protocols, because nature heals.
And with that, I have to say those words are so comforting for those people who feel that doctors' prescriptions and all of those vials that line their shelves have failed them. We have heard here today that we have the power to heal ourselves. So, Linda, thank you so much. I hope to make my way down to New Mexico one day.
I'm waiting for you.
Have our paths cross in person. Thank you so much, and have a wonderful day.
Yeah, you too. Lovely.
Take care.
Okay.